Hi, I'm Dr. Sally Primus. I'm a board certified ophthalmologist with Hometown Ophthalmology and the Dry Eye Center of Evansville. This video is a part of a series where I go through many of the common dry eye treatments and I talk about how they work, how to use them. I'll even try some of them out right in front of you. I'll talk about whether or not you can get them on your own or if you need a prescription, whether insurance might cover it or not. And I'm happy to answer any questions. And if you want to learn more, you can check out our website at either hometownophthalmology.com or dryeyevansville.com. In this video, I want to talk about some procedures that we do in the office. They are amniotic membranes and punctal plugs. I'll start with punctal plugs because we do those very often. There is a tiny little hole. If you were to look in a mirror right in this corner, you'll see a tiny little hole in your eyelid. There's actually one in the upper eyelid as well. This is the opening to drains that take your tears away. We make tears mainly up here. They flow across the eye. They drain down that tube and basically end up in the back of the nose and down your throat. That's why some people, if they put a bunch of milk in their mouth, they can blow bubbles that come out the inner corners of their eyes. It's all connected. Well, if you want to have more tears on the eye, you can try to slow down how quickly they drain away. So we can actually plug those drains. You can plug both the lower and the upper punctum. I don't like to do that. I usually only plug the bottom one. I like to have some flow going through a system that's designed to have flow. I really don't want to stop everything in there. I feel like it increases your risk of infection. 60% of the flow does go through the bottom, which is why I choose to plug the bottom one. This is an in-office procedure. It is actually just done in the same chair that we do your exam. I just lay you back and pop them in. It is a painless procedure. I put a numbing drop in. There's no cutting. There's no sharp needles. There's nothing like that. So the first thing I do is I have this is nothing sharp. It's just a little, kind of a pointed like a little cone that I just go into that hole and I just very gently kind of twist back and forth and make that hole slightly bigger. You're numb. You can't feel it. You might feel a little pressure, but nothing uncomfortable. I've had patients that were very scared of getting punctal plugs for a long time, and after I pop them in, they're like, that was it? Yeah, that's it. It's pretty simple. So once I made that opening a little bigger, I can slide in the plug. I have several different brands of plugs. I have temporary plugs, I have permanent plugs, I have other brands of permanent plugs, just depending on the patient need. I usually like to do a temporary plug first because I want to make sure it's not going to cause any problems. Some people, their eyes will water when they have dry eyes, so if I put a permanent plug in and it turns out that they water too much and they don't like it, it's harder to get out versus a temporary plug will dissolve and go away and take care of itself over time. And so you probably can't even see this, but this is one of a temporary plug. If you can even see that tiny blue dot in the middle of that white, that's how tiny this is. And this is a 3-month plug. It'll last for about 3 months. There are ones that last about a week or so. I think 3 months is a great way to know if it's going to work. And that way, if it helps and around 3 months later you start getting worse, okay, yeah, we know it worked and let's put a permanent one in. The permanent ones go in the same way. It's all just done in the office and it's simple. And so it's something that insurance does cover, and even if insurance doesn't cover, it's not too pricey and can be repeated if necessary. The permanent ones probably are not going to last your whole lifetime, but they will last for years. The other thing I wanted to talk about in this video is something called amniotic membranes. Now there's multiple brands of this. If somebody has just severe dry eyes and the skin on the front of the eye keeps cracking open and breaking and it's painful, we can kind of reset the corneal surface, and that's what's affected in dry eye. So these are dehydrated amniotic membranes. They are sterile. They have been screened for disease. There's no risk there. And what we'll do is we'll put a little eyelid opener real quick in the office. Again, this doesn't hurt. We put the amniotic membrane on the cornea and we put a contact lens in. You leave that contact lens in for about a week. You're on an antibiotic drop just to prevent infection during that week. And then a week later, I bring you back to the office and I quickly take the contact lens out. And I have had a lot of success with this, just kind of resetting the corneal surface and helping with that pain. Now, if we don't treat the other things causing the dry eye, it will come back. But when we are aggressively treating the dry eye, but we just need to jumpstart things, these things can be great. Depending on your diagnosis, This can be covered by insurance, often completely covered by insurance. Medicare is great about covering this. And so I really feel it's an important tool in my toolbox. Not for everybody, but for the right patient, it can really make a difference.